Okay, uh, welcome to Basic Veterinary Pharmacology with the module code PST06107. So this is Basic Veterinary Pharmacology. So from the basic knowledge that you have, I know everyone knows what is pharmacology, and I cannot explain basic, so you know what is pharmacology. But now we are going to the new uh, part of pharmacology, which is veterinary pharmacology. So someone will be asking, what is veterinary? So if we go to dictionary, what is veterinary? So veterinary actually is, the meaning of veterinary is something that is relating to disease, injury, and treatment of farm and domestic animals. So whenever you hear the word veterinary, you are talking of either a disease or an injury, a disease or injury or treatment of any animal. So this animal can be a domestic animal or it can be a farm animal. So whatever you hear about the word veterinary is something related to animals. It can be a domestic animal or a farm animal. And so from this meaning, we can elaborate in Swahili by saying these animals we have, wanyama hawa ambao tuko nao wako tunaowafuga wa kuishi nao nyumbani na wale ambao tunafanya nao kazi katika mashamba. So hawa wanyama wote wanaunda wanyama ambao tunawatibu au katika kuwatibu tunawatibu either injuries, kuumia kwao au magonjwa fulani fulani. So this is the meaning of veterinary. So whenever you hear the word veterinary, is something related to animals, which is about diseases, injury, and treatment. So that is the meaning of veterinary. So from the meaning of pharmacology that you know, then we can join the two words by beginning with the first session of introduction to veterinary pharmacology, and then we will define the word veterinary pharmacology as the study of substances, and these substances interact with living systems through chemical processes, especially by binding to a regulatory molecule and activating or inhibiting the normal body processes in the animals. The definition is very similar to the definition of basic veterinary pharmacology, of basic pharmacology. So when you were studying basic pharmacology, actually the definition was about substances that can interact with the living system. And then by interacting with the living system, they can either regulate in any way that particular living system. So in here it is a very same definition, but we add something about animals, that now we are talking of this interaction of living systems that are found in the body of animals. So we are talking of animals now, not human beings. So veterinary pharmacology also is concerned with the use of drugs for diseases and health problems that are unique to animals. So we are discussing the use of drugs to the treatment of health problems which are unique to animals. So we are doing the same thing that we are doing to human beings by using drugs, but now we are doing that thing, whatever we can do with the drugs, to the animals. So that is veterinary pharmacology. So there are so many sources of veterinary medicine. In pharmacology, we are talking of medicines, and you all know the difference between medicines and the drugs. So we use medicines in veterinary also, and we have so many sources of veterinary medicine, and these sources are similar to the medicine sources that are found in human medicine. And these sources include plants, animals, minerals, and other synthetic sources. These are the commonly known sources of medicines, but there are other sources of medicines, but I didn't mention it here. You know the sources of human medicines is the same as the sources of veterinary medicine. So there are various therapeutic classes of veterinary medicine. So there are classes of medicines, therapeutic classes of medicines in human beings. Also, we have therapeutic classes of medicines in veterinary. So in veterinary, these therapeutic classes of medicines, and actually when you hear the word therapeutic classes of medicine, you are talking about the classes of medicines based on their therapeutic application of those medicines. So in which way the medicines are used, or are used for what. Now, that therapeutic purpose of the medicine is what makes the class of those medicines. And these therapeutic classes of medicines, you study them in basic pharmacology, is the same as in veterinary pharmacology. These classes include antibiotics, antifungal, antiviral, anti-inflammatory drugs, growth promoters, antiparasitic drugs, insecticides, and tranquilizers. All these are therapeutic classes of medicines, and you can find them in human beings and also are the same therapeutic classes of medicines found in veterinary pharmacology. And so there are various principles and the concepts of veterinary pharmacology that are similar to human pharmacology. And these principles, they involve pharmacokinetics and pharmacodynamics. In human pharmacology, you studied pharmacokinetics and you know what is it, and also you studied pharmacodynamics. And in veterinary pharmacology, it's the same concepts and the principles that we have. So we will go through these principles. And pharmacodynamics, as you all know, is the study of cell and tissue response and selective receptor effects. You know the meaning of pharmacodynamics. We are talking of the response of a certain body tissue towards drugs. So, and also there is a significant difference in veterinary pharmacology that exists between species. Uh, in veterinary pharmacology, we will discuss something known as species variations. Species variations, what do we mean by that? Species variations, we mean that, okay, I will explain like this. When you were studying pharmacology in human beings, that pharmacology was based on human beings, and all human beings are of one species. All human beings are Homo sapiens. All of them are one species. But now we are talking of veterinary pharmacology, and this veterinary pharmacology we are talking of pharmacology on animals. And these animals, provided they're domestic animals or they are farm animals, both of them, if you mention five, they are coming from different species. For example, if the domestic animal like cat, dogs, a hen, or a duck, all these animals are domestic animals, but their difference is they are coming from different species, very different species. You can talk about cows, goats, rabbits, all of them are coming from different species. So there is a certain thing that is different a little bit in veterinary pharmacology compared to human pharmacology, is that here we are talking of pharmacology in a group of animals that comes from different species. And by them being of different species, then there is a difference in the way these animals respond to drugs. And those variations, we call them species variations. And the way the body will respond, or the way these animals will respond to the drug, is based on how on that particular species, and in another species it will be a different response. So there is a significant difference in veterinary pharmacology, and this is the species variation. So we needed to explain in detail about these particular variations. So these variations, they have a significant influence on pharmacokinetics and pharmacodynamics of veterinary medicine. So the variations, the species variations, is very important to understand it when you are talking of pharmacokinetics and pharmacodynamics of veterinary medicines. Uh, then later on, we will discuss in detail about these species variations. Right now, let us come into some other definitions of important terms that is going to be used continuously during our discussion. Let us begin with the definitions of toxicology. Toxicology is the study of poison and the effects of those poisons on the normal physiology of an animal. Yeah. So toxicity is the quality of being poisonous or the dose of poison that elicits a response. So there are two words here with a different definition. There is toxicology and toxicity. Toxicology is, you know, the meaning of the word ology is the study. So toxicology is the study of poisons and their effects in the normal physiological mechanism of an animal. But toxicity is the quality of that particular poison, the quality of the poison, or how the poison is poisonous, you can say that. So we are talking of the dose of that poison that would elicit a response. And when we are talking poison, here we are talking of the effect of a particular chemical on a living system. So the amount of that effect, that it is measured as toxicity. So it is very important to understand the more commonly encountered toxins so as to treat the affected animal accordingly. So when you're treating an intoxicated animal, the general rule to remember is that treat the animal and not the poison. So that is very important. If an animal is intoxicated, an animal can be intoxicated by any chemical. Yeah? Even if it is a drug, a very good drug, a very good medicine. If a certain dose is exceeded, if the dose is more than what is required for that particular animal, then the animal will be intoxicated. So that's where the toxicity comes in. So it can be a very good medicine, but if you exceed a certain dose, that dose will cause toxicity in the animal. So what we are saying here is when you are treating an animal and then the animal is intoxicated, then do not base on the poison directly, but based on how to deal with the animal to eliminate the poison. Yes, that's a good approach and a good general rule to remember during dealing with these intoxicated animals. Then there is toxicosis. Toxicosis is the clinical syndrome that is associated with exposure to a poison. It means now these are the syndromes, clinical syndromes that occur after encountering or after the exposure to the poison. The animal, when is exposed to the certain poison, that animal will show a certain clinical syndromes. And those syndromes will tell you that the animal is intoxicated by such and such poison. For example, there is acetaminophen toxicosis. So it is a paracetamol toxicosis. So you know it is a paracetamol toxicosis because of the clinical syndromes of that toxicosis. The syndrome will define what is poisoning that particular animal. Toxins. Toxins that affect the more commonly domestic animals are extremely diverse. So there are so many toxins that can intoxicate, that can harm all the domestic animals. So all these domestic animals, they can be intoxicated by so many things. So toxins are extremely diverse. We cannot say, let us mention the toxins. Everything can be a toxin at a certain concentration. So it's very diverse to mention a particular toxins. But there are some types of toxins that are often encountered. They are commonly known toxins. They are metals, mycotoxins, feed-related intoxications, pharmaceutical agents, pesticides. Here we include insecticide and herbicide, biotoxins, plants, poisonous animals and insects, bacterial toxins, and so forth. So these are types of toxins, actually what we are talking here. So let me explain it very better in Kiswahili. Hapa tunaongelea aina mbalimbali za sumu ambazo zinaweza kuwapata wanyama. Sasa sumu ziko nyingi sana. Mnyama anaweza akapata sumu nyingi sana anavyoishi mazingira karibu na binadamu. Sumu zingine zinaweza kutokana na dawa anazopewa na nini, lakini sumu zingine zinatokana na vitu vinavyompata katika mazingira yanayomzunguka pale anapoishi na wanadamu. Kwa hiyo unapodili na wanyama ni lazima ujue aina ya sumu ambazo wanyama wanaweza kuzila au kuzipata wakiwa katika maisha yao wakimzunguka huyu binadamu. So binadamu anaweza kusababisha sumu nyingi ambazo zinaenda kuwapata hawa wanyama. Sasa hizo sumu zinaweza zikatokana na metals, material mbalimbali zinazotokana na metals ambazo zipo katika mazingira ya binadamu ambazo zinaweza kumwathiri mnyama. Mycotoxins, sumu mbalimbali ambazo zinatokana na fungus, fungal infection, fungal toxins ambazo ndo hizo mycotoxins. Fungus wako wengi kwenye mazingira ambayo binadamu wanaishi, au fungus wanaweza kuleta sumu ambazo zinaweza kuwadhuru wanyama. Feed related intoxications, kuna sumu fulani vinaweza kuchanganyika au kuwa katika vyakula ambavyo wale wanyama wanakula. Vyakula vya wanyama vinaweza vikasababisha intoxications au wakapata toxins fulani. Pharmaceutical agents, vifaa mbalimbali vya kifamasia ambavyo hawa wanyama wanavyoencounter kwenye mazingira wanayoishi na binadamu vinaweza kuwa sumu kwa wanyama hawa. Pesticide, dawa ambazo zinatumika kuua wadudu waharibifu au kuua mimea ambayo haitakiwi. Herbicides, dawa zinazoua mimea ambayo haitakiwi, au insecticide, dawa zinazoua wadudu wasumbufu au waharibifu au wadudu ambao hatuwahitaji kwenye mazingira ya binadamu. Hizo dawa zinaweza zikaathiri wanyama ambao hatutaki waathirike, domestic animals. Biotoxins, so sumu mbalimbali za kibiolojia. Hizo sumu zinatokana na mimea, zinatokana na wanyama wenye sumu, zinatokana na wadudu wenye sumu, au zinatokana na sumu za bakteria. Hizo zote kwa pamoja zinaitwa biotoxins. Kwa nazo ni sumu ambazo zinaweza zikamwathiri mnyama. So that's the details about the types of toxins that can be encountered by animals. So for a toxicosis to occur, there must be a dose-related response. The greater the dose, the more likely the toxicosis will occur. So toxins operate like drugs. Toxins provide effects like drugs. And in talking about the effect of a drug, actually we are talking of a dose-related response. So even your toxins operate in the same manner, dose-related response. The greater the dose, the more likely that toxicosis to occur. That means a dose determines the strength or the amount of toxicosis that the animal will be encountered for after a certain access to a certain toxin. So some toxins will exhibit a steep dose-response relationship and are highly considered to be toxic. So if a dose-response relationship is very steep in the graph about dose-response curve, if the graph is very steep, that is considered highly toxic. I'm just explaining in simple words like this because I know you know the graphs of dose-response relationship. You know those graphs, you studied them in basic pharmacology. So I'm just reminding you that if the graph is very steep, that means the toxins is very highly toxic. So that's the concept we know from basic pharmacology. Now, to cause intoxication, a substance that must be absorbed and be delivered to the site of action at a concentration higher than enough to elicit a physiological response. That is, for example, presence of a poisonous plant in a pasture is not enough. There must be evidence of consumption of these plants. So the concept of intoxication is a substance that has to cause intoxication must be absorbed and must be transferred to the site of action at a certain concentration that is high enough and to cause a certain physiological response. Because that physiological response is the one that will tell us the animal is intoxicated. If there is no physiological response, we will never know, or it will not be encountered as intoxication, or the animal is not intoxicated because you cannot see the physiological response. So that substance which we consider it to be toxins, it has to provide intoxication if it elicits a physiological response. Let me explain like this. Kwa hiyo tunaposema huyu mnyama ameathirika na sumu fulani, ile sumu haina maana kama yule mnyama amekula ile sumu na ile sumu haijasababisha madhara yoyote ya kifiziolojia mwilini mwake. Kama haijasababisha madhara yoyote ya kifiziolojia mwilini mwa yule mnyama, hatuwezi kuisema hiyo ni intoxication, au hatuwezi kusema huyo mnyama amedhurika na ile sumu, au hatuwezi hata kujua kwamba amepata hiyo sumu au amekutana na hiyo sumu. Kwa hiyo kikubwa kinachoongelewa hapa kwamba unapoona kitu kinaitwa intoxication, unapoona kitu kinaitwa mnyama amekula au amekunywa sumu au amepata sumu ya kitu fulani, ni pale ambapo maana yake ni nini? Maana yake ni kwamba yule mnyama ameila hiyo sumu au imemuingia mwilini mwake hiyo sumu, then absorption ikatokea, then hiyo sumu ikafika kwenye eneo la mwili. Ilipofika pale ikawa katika concentration fulani ambayo iko juu, ambayo hiyo concentration inasababisha yule mnyama physiological response yake au matokeo yake ya kifiziolojia kwa yule mnyama yaweze kutokea, ambayo yanaonyesha kwamba yule mnyama ana kitu fulani ambacho si cha kawaida mwilini mwake. Kwa hiyo kwa maana nyingine ni kwamba wanyama wanapokuwa wanakula mimea huko, wanaweza kukutana na mmea mmoja ambao una sumu. Akila ule mmea ambao una sumu, kama huko ni mmea mmoja au ni mimea michache, inakuwa haitoshi kuleta ile concentration kubwa ambayo inaweza kusababisha madhara ya kifiziolojia. So anaweza akala sumu, lakini ile sumu isilete madhara kwa yule mnyama, isilete madhara ya kifiziolojia kwa yule mnyama, kwa sababu concentration ya hiyo sumu sio nyingi, au kiwango cha hiyo sumu mwilini sio nyingi. Kwa kitu cha kwanza ni amount, kiasi cha sumu ambacho mnyama amekula au amekunywa au imemwingia hiyo sumu kupitia njia nyingine yoyote. Hiyo ndio evidence ya kwanza. Lakini hiyo ndio kitu ya kwanza. Kitu ya pili ni kwamba lazima yule mnyama awe ameila hiyo sumu. Ameila, ameinywa, whatever, iwe amefanya consumption, imemwingia mwilini mwake, either kwa kula au kwa kunywa, au pia kupitia wanyama wengine wanaweza kuleta sumu. Kwa bila hivyo hakuna intoxication kwa mnyama. So jambo la kwanza lazima kuwe na kuingia kwa hiyo sumu mwilini. Jambo la pili, hiyo sumu iwe katika concentration fulani kubwa. Hapo ndipo kitu kinaitwa intoxication kinatokea. So different animals in a herd may consume different plants or forage, and the individual and species variations in susceptibility to toxins and the clinical signs observed must correlate with the suspected plant. Kwa hiyo kuna aina mbalimbali za wanyama ambao wanakuwepo katika mazingira yetu tunaoishi nao, na hawa wanyama wanaweza kula aina mbalimbali za mimea au kula aina mbalimbali za vitu vinavyowazunguka. Lakini pia hawa wanyama wanatofautiana. Sumu ambayo itamuathiri paka si lazima hiyo sumu imuathiri mbwa, au sio lazima hiyo sumu imuathiri mbuzi au ng'ombe. Kwa hiyo kila mnyama ana namna yake anavyorespond kwenye hizi sumu, na ndio maana tumesema kwamba susceptibility to the toxins is very individualized. Yani ile kwamba anaathirika na sumu hiyo sio kwa kila mnyama. Kuna aina tu, mnyama huyu anarespond hivi, yule anarespond vile, inakuwa tofauti. Na hii ni kwa sababu ya kitu kinaitwa species variations. Utofauti wao katika species ndio unaowafanya hawa wanyama wawe na matokeo tofauti au wawe na response tofauti wanapokutana na hizi sumu. Lakini sasa hizi sumu tutazijua kwamba huyu mnyama amekula sumu fulani, au amekula sumu ya mmea fulani, au amekunywa sumu kutoka kwenye sumu, amekunywa kitu chenye sumu fulani. Tutaijuaje? Tutaijua sumu kwa kuangalia dalili anazozipata, clinical signs. Zile dalili ambazo yule mnyama anazipata baada ya kukutana na hiyo sumu, hizo ndo zitatuambia kwamba amekula nini au amekunywa kinywaji chenye sumu aina gani. Hiyo ndo itatuambia zile clinical signs. So hiyo ndo concept nzima ya toxicology, sumu katika mwili wa mnyama. Toxicology tunasoma study of toxins. Kwa hiyo ni introduction tu kuelezea toxicology ni nini toxicity ni nini na toxins na vitu kama hivyo. Lakini pia kuna toxicokinetics. Toxicokinetics is the study of metabolic processes that occur after exposure to a toxins. So toxicokinetics, we are talking of the metabolic process. The metabolic process of an animal after exposure to the toxins. After the toxins has entered the animal, what are the metabolic processes that occur? That study of those metabolic processes, what we call toxicokinetics. And the toxicokinetics we are talking about here is absorption, distribution, biotransformation, and elimination. So the toxicokinetics involves the mathematical description of the movement of toxins into the body. So we are talking of the toxins moving into the body, we call that absorption. Then the toxins moving to the target organ, we call that distribution. And also the toxins to get out of the body, and we call that elimination. So we are talking of the whole description of the movement of the toxins from entering the body, moving around into the body, and then getting out of the body. So those are the movements of the toxins in the body, and at the start of those movements we call it toxicokinetics. So the concentration of the toxins at the site of action depends on the following issues. We say the toxins enter into the body by absorption and they move to the target organ, or they move to a certain point of the body where they're going to affect that part. Now, moving to that particular part of the body and then causing effect, physiological effect to that body part, then there are factors that determine the effect of the toxins at that particular point of action or side of action. And these points that determine the response or the outcome of the toxins at the site of action is dose, physicochemical properties of the toxin or drug, absorption, distribution, specific tissue affinity, rate of metabolism, and rate of elimination. So we can agree that all these factors, all of them, they are what we call kinetics. Either it is toxicokinetics or it is pharmacokinetics. These are the determinant of the processes that involve the movement of the toxin or drug into the body. So we are the effect of the toxins at the site of action, the concentration of the toxins at the site of action, which is the concentration now is directly proportional to the effect, depends on those physical chemical properties, absorption, distribution, specific tissue affinity, rate of metabolism, and rate of elimination. So remember those factors. The fate after exposure to toxins is influenced by the following issues. The fate. So the outcome after exposure, or what happens, what will then be the result of the exposure to the toxins, and what are these issues that influence this outcome of the exposure to the toxins. So toxins or drug factors, they can influence the outcome of the exposure to toxins, toxin itself and the drug factors, and also host factors or physiological factors, the factors of the animal itself. So the outcome after exposure to the toxins, au matokeo ya nini kinatokea baada ya sumu kumwingia mnyama, there are two things ambavyo vinaathiri yale matokeo. Ya kwanza ni sumu yenyewe inaweza ikaleta matokeo fulani, au dawa ambayo yule mnyama amekunywa inaweza ikaleta matokeo fulani. Lakini kinachoathiri pia matokeo ya ile sumu baada ya kuingia mwilini mwa mnyama ni factors zinazohusiana na mnyama mwenyewe, yeye mwenyewe, kuna factor fulani au physiologic factors, factors za kifisiolojia ndani ya mwili wa yule mnyama. And these host factors or physiologic factors, the factors depending on the animal. So there are factors depending on the toxin itself. Now also there are factors depending on the animal itself. Now from the animal itself, we are talking about age. Organ perfusion means the amount of blood going to a certain organ. organ function, yeah, which organ and what does it do. For example, maybe it is liver or it is kidney. Now the function of the organ is very important. Membrane permeability, how materials can move across the membrane of that animal, the rate and whatever. pH of the tissue or compartment, species, and the gastrointestinal anatomy and the physiology. So these animals, they define the anatomy and the physiology of the gastrointestinal tract. So that can affect the response towards toxins. And also the type of a species of that particular animal. It can determine the outcome of the toxins or the fate after exposure to a toxin. So that is toxicokinetics. So we were talking about the toxins and the way we can explain about toxins in the animal body. But the very similar word, we can find it in terms of drugs. And when we are talking of the kinetics of a drug, that we call it pharmacokinetics. So we have the kinetics of the toxins, uh, things that can intoxicate the animal. We call that toxicokinetics. But there are kinetics of drugs or effects of drugs in the body, the metabolic effects that can affect the drug in the body, and we call that pharmacokinetics. So now in pharmacokinetics, we are talking of drugs that we use in treatment of diseases. In toxins, we are talking of chemicals that can intoxicate the animal, causing toxicity in the animal. It can be a drug or it can be any other thing. It can be anything, a certain chemical around a human being environment, or a poisonous plant or a poisonous animal, whatever. Poison, or toxins. Now that is toxicokinetics, about poisoning the animals. The kinetics of poisoning the animal. But pharmacokinetics, we're talking of drugs that are used for treatment of animal disease. Now these drugs, when they come into the body, the same fate happens. Whatever happens in the toxins also happens with drugs. Now with the drugs, the pharmacokinetics is the study of drug absorption, drug distribution, drug metabolism or biotransformation, and drug excretion or elimination. Now, the pharmacokinetic process, it can affect the route of administration, the dose interval, and the toxicities of drugs given to animals. So, pharmacokinetic processes and all pharmacokinetics in general, it affects in a certain way the absorption, distribution, metabolism, and the excretion affects the route of administration. So if you look on the absorption factors, distribution factors, by transformation or metabolism factors, and excretion factors, all of them, they can determine the route of administration of a certain drug. Also, these pharmacokinetic factors can determine the dose of the drug. These pharmacokinetic factors, they can determine those intervals of a drug. And these pharmacokinetic factors, they can determine toxicities of drugs given to animals. So from pharmacokinetic factors, we can find out that which amount of a drug can be transformed into a toxin. Yeah, that is from pharmacokinetics. So the pharmacokinetics, as we were saying here, is the study of the drug absorption, distribution, biotransformation, and excretion. So let us see the importance of veterinary pharmacology. Importance of veterinary pharmacology. Why do we have to study veterinary pharmacology? What's the importance of it? So we study veterinary pharmacology because it can help us to understand the mechanism of action of veterinary medicine. So we will know the way this veterinary medicine works, and it will help us to determine the correct indication dosage of veterinary medicine. So we will know the indications of different veterinary medicine and their dosage, how they are used, and so forth. And also helps to identify and respond to drug interactions, contraindications, adverse drug reactions, that are related to veterinary medicine accordingly. So we are going to know these ADRs, contraindications, interactions of veterinary medicine, and then we can deal with them accordingly. And also, it can help us to understand the disposition process in the body. Disposition process in the body, and this disposition process in the body, we are talking about absorption, distribution, metabolism, and elimination of these veterinary medicine. So in short, we are going to understand the pharmacokinetics of veterinary medicine. And this will help students to learn veterinary pharmacology to dispense right drugs to the right animal at right dose by right route and the right time. So we want you as a students to know the rational use of veterinary medicine. So we we as pharmaceutical personnel, we must know how to deal with veterinary medicine. So in our pharmacies or in the drugs outlets, in some point you will find out also a segment of veterinary medicine. So we must know how to dispense veterinary medicine. So maybe someone was wondering, why do we study veterinary medicine? We study veterinary medicine because we are pharmaceutical personnel and we are obliged to deal with veterinary medicine. Now, if we are obliged to deal with the veterinary medicine, we must know how to deal with these veterinary medicines, how to dispense veterinary medicine. To know how to dispense it means to know the right drug for the right animal, the right dose, the right route, the right time. So all these we can know them through veterinary pharmacology. So you know why we study veterinary medicine, veterinary pharmacology up to now. So by rounding up this first session, the key points that you must keep in mind is the meaning of veterinary pharmacology. You must keep in mind the definition of veterinary pharmacology. Also, you must know the principles and the concept of veterinary pharmacology. And also, you must know the meaning of toxicology, and you must know all the details of toxicology, toxicities, different toxicities, and you must know toxicokinetics and so forth. And then you can uh, ask yourself these questions and do it as a practice questions. Try to define on your own veterinary pharmacology. Try to explain the principles and concepts of veterinary pharmacology. Try to list and to at least to remember the importance of veterinary pharmacology. And also you must know how to define toxicology and to define pharmacokinetics. So these are the evaluations questions that you can do and practice more about what we studied. So this is the first session, and thank you for listening. In case of any questions, now you can ask different questions. Thank you.